Good evening, and thank you for attending the Share the Care Ball, A Journey. My name is Tom Shanley, and I'm the President and Chief Executive Officer at Ann and Robert H. Lurie Children's Hospital of Chicago, and a member of the Board of Directors for Almost Home Kids. It is my distinct privilege and honor to recognize Dr. Larry Kosiolek as this year's Share the Care Exemplar Award recipient. It has been almost 2 years since experts in the field of infectious diseases found themselves front and center of staff meetings, community panels, and the media in all its forms. As they discerned real-time data from across the globe, they were responsible for answering a barrage of questions and providing the best possible advice on the COVID-19 pandemic. For us at Lurie Children's and Almost Home Kids, this critical leadership spotlight was on Dr. Kosiolek and his Infection Prevention and Control Task Force, who proved to be more than up to the challenge. Dr. Kosiolek is a pediatric infectious diseases physician scientist and the medical director of Infection Prevention and Control at Lurie Children's. He holds the Irene Heinz Given and John Laporte Given Professorship in Pediatrics and is an assistant professor of pediatrics at Northwestern University Feinberg School of Medicine. His research interests focus on the epidemiology, diagnosis, and prevention of infections acquired in healthcare settings and high consequent pathogens in the community, most notably COVID-19 and C. difficile infections. He has led Lurie Children's COVID-19 response and worked with hospital, community, government, and public health care stakeholders to expand COVID-19 related services for children and families, including educational resources, testing, vaccines, and guidance for safely returning children to the classroom. Almost Home Kids has benefited greatly from Dr. Kosiolek's expertise. His lead role on Lurie Children's Infection Prevention and Control Task Force was a vital resource and the reason there have been 0 cases of COVID-19 attributed to the children in our care and no cases of staff or caregivers contracting the virus at Almost Home Kids. In a time when retirement homes and long-term facilities saw disastrous and tragic numbers of COVID-19 within their walls, steady guidance and the actionable advice we received from Dr. Kosiolek and his team ensured Almost Home Kids did not succumb to the same fate. This was also the case when we restarted our volunteer program. We were able to implement a plan devised by Dr. Kosiolek's team that not only saw volunteers get fully vaccinated against COVID-19, but also established a clear set of protocols and procedures that have become our blueprint for the volunteer program. The resulting success of these measures has caught the attention of the Illinois Department of Public Health, who have been in contact with Almost Home Kids to help shape a set of standards that other facilities will implement and replicate. Dr. Kosiolek, congratulations again, and thank you for your leadership and excellence throughout this journey.
Thank you, Dr. Shanley, for the very kind introduction. And my sincerest gratitude to the Almost Home Kids team for recognizing me with this award. For the past year and a half, I have had the great honor of being one of the leaders of the Lurie Children's COVID-19 response. While words cannot quite express the enormous challenges we have faced, the most gratifying part of this work is how extensively I've been able to work with many other leaders across the Lurie Children's enterprise. To quote 19th century novelist James Lane Allen, adversity does not build character, it reveals it. I have experienced firsthand the incredible work an organization can do during a crisis when teams come together to achieve a common goal. In this case, to keep patients, families, and healthcare workers safe and healthy while staying true to the organization's mission of advancing the health and well-being of children. My work with the team at Almost Home Kids has been a particularly bright spot over the past year and a half. Almost Home Kids is a very special place. There are very few facilities in the U.S. that can provide a home-like environment that not only provides much-needed post-acute and respite care to a particularly vulnerable group of medically complex children and their families, but they have developed a physical space that promotes congregation and interaction, a space that is inviting for families, and a space that offers an alternative to the hospital environment that can sometimes feel isolating for families. When the pandemic began, honestly, I had significant concerns about this type of healthcare environment. As Dr. Shanley mentioned, early in the pandemic, post-acute and long-term care facilities were common sites for super spreader events. COVID-19 would spread through these facilities like wildfire, and because individuals with medical complexity were more likely to suffer from COVID-19 complications, many patients in these settings simply did not survive their infections, particularly early on in the pandemic when effective COVID-19 treatments were not yet available and vaccines had not yet even begun clinical development. Imagine the fear and frustration that comes with the realization that the very characteristics of Almost Home Kids that make it an incredibly special place also add substantial risk of COVID-19 for patients and their families. Perhaps not surprisingly, the administrative, physician, and nursing leaders at Almost Home Kids were undeterred. Together, we relied on the science available and our experience with other respiratory viruses to identify the most significant risks and methods by which to mitigate those risks, to substantially reduce the introduction and spread of COVID-19 into the facility while maintaining much of that home environment that allowed its children to rest, recover, and thrive. Together, we reinforced a culture of safety and accountability for staff and visitors to ensure that we kept those with COVID-19 symptoms or exposure out of the facility until they had recovered. We used screening testing to permit children to come and go between their home and other medical facilities safely. We used personal protective equipment that allowed our children here, the staff here, and the children's families to safely interact, and we fostered that strong patient, family, and facility relationship that makes Almost Home Kids special. And most importantly, as we learn more through the evolving science and ongoing experience, we too evolved our policies and practices. Through the work our team has done together, we have kept Almost Home Kids safe, and we have not compromised on its mission and vision. And now, after a year and a half of tireless efforts of scientists around the globe, we are mere days away from vaccinating young children against this deadly virus. The future is bright. We are stronger together, and I'm forever grateful for the work we have done and the relationships we have built. I am thankful for your trust in me to help keep Almost Home Kids safe, and I am enormously humbled by this award. Thank you.
Steve, thank you for joining us for the Share the Care Ball, a Journey event, even though the only way we could get you here is virtually. When we embarked on this campaign to build our second site in Chicago in 2010, Gary Lee, who led the architectural interior design, introduced us to his very close friend, Steve Liska, whose graphic design firm, Liska & Associates, specializes in designing, game communication, and branding. Steve was responsible for our logo, our redesign, reinforced our strength and stability, and envisioned us going from suburban to urban and beyond. You've always believed in us, and you got me to keep my message short and precise, which is not an easy thing to do. So thank you for that. His thoughtful selection of corporate colors and countless strategy sessions have helped us attract new audiences by being memorable and staying current and looking very cool in the process. Steve also helped us position us during our affiliation negotiations so that we would be able to protect our brand and our identity that I will be eternally grateful for. He has given us guidance with our language, most recently in the drafting of our new mission and value statements. He has been responsible for the layout design of our collateral material, newsletters, and annual report. And he's designed both of our public website and internal playbook. All of this is on a pro bono basis through the kindness of his heart, and he always has treated us like his top paying client. His expertise and willingness to give us these services means so much to me personally and professionally. I have honored this relationship I've had with you, and I've learned so much from you. And thank you for putting up with me. And with that, also Judith and Rayanne and the rest of my team, we're grateful for everything you've done. Some of our favorite stories include Steve and his red pen. He's known for having artful edits with humor, and his unique flair and creativity always shine through. And I know I speak from all of us at Almost Home Kids when I say we could not ask for a more talented graphic designer to help steward our cause, or more importantly, a better friend. Steve, please accept this Share the Care Champion Award as a token of our gratitude for all of your exceptional support of the children in our care, their families, and everybody at Almost Home Kids.
Well, thank you. Thank you so much. That's really wonderful. You know, I think like everybody else in the world today, you know, we're hoping to make a difference. And I think being involved with Almost Home Kids over the years has helped us to make a little difference in the world by making things more clear, more concise. You know, the world of medicine and healthcare is so difficult to communicate because it's so complicated. And, you know, it involves, you know, science, which is all about, you know, medicine and technology and equipment. It involves emotion. You know, I think one of the things that we've learned over the years working in healthcare is that emotionally, people hear about 2% of what a doctor or a caretaker says, and then it has to be told over and over again because they're so emotionally fraught. I think the emotional part is so difficult for everybody, and I think that's a big part of what Almost Home Kids is involved in. And then the third part is support. You know, I think that's where Almost Home Kids, I've watched them over the years step up more than anybody to be able to support families. And a lot of medical institutions, you know, they take care of the first two parts and then they send everybody home, but not Almost Home Kids. They work so hard to make sure that everybody is, you know, well maintained, that they are well cared for, and that there is a family of people that, you know, look out for the evolution of whatever kind of healthcare needs exist. So I think that, and I would say on top of all that, it's the nicest, sweetest, hardest working people I've ever met in the healthcare industry over the years, which is critical for healthcare. And so thank you very much for this award. I really appreciate it.